Hey fellow nurses, Nurse Tracy here. Let's do some quick stretches for our stresses from being on our feet all day, all shift long, walking many hours. Let's get some relief through our legs, our feet, and our back. Let's begin by finding a comfortable seat in a chair, hopefully a chair without wheels. If all you have access to is a chair with wheels, you want to lower the chair down so that your thighs are parallel at the same level as the ground, horizontal. Feet flat on the floor. Knees directly in front of the hips if that's comfortable for you, and feet hip width apart, knees directly above the heels. At any time during our stretches, if you feel discomfort, back off the stretch slightly. We just want to feel some comfort with the stretches. Let your eyes begin to close or a soft gaze towards the ground. Inhale, bring the breath to the top of head. Exhale, send the breath down the spine, down the low back, out and away from you. Inhale, chest rise. Exhale, melt shoulder and shoulder blades down. Inhale, ribs expand. Exhale, ground down into the sitting bones. Second round, inhale, breath to top of head. Exhale, send the breath down the spine, down the low back, out and away from you. Inhale, chest center, rise. Exhale, melt shoulder and shoulder blades down. Inhale, ribs widen. Exhale, grounding down into the sitting bones. And begin to flutter your eyes open. Shoulder circles. Inhale, shoulders up. Exhale, roll the shoulders back. Inhale, shoulders up. You're lifting the shoulders up, not so much squeezing the trapezius muscle. It's a lift through the humerus bone. Exhale, round back. Squeeze your space in between the shoulder blades together. We're opening up through the chest, undoing all that hunching over we've been doing over the patients, all the hunching over we've been doing at the computer, whether you use a computer on wheels or a desktop. Inhale, shoulders up. Exhale, shoulders back, squeezing the space between the shoulder blades together. Inhale up. Exhale back. Wonderful. Let's interlock our fingers together. Flip the palms so that they're facing me. Inhale here. As we exhale, we're melting the shoulder and shoulder blades down. Again, avoiding the urge to contract this trapezius or any of these neck muscles. Pushing the hands and fingers away, feeling a good stretch in these metacarpal bones. Inhale, lengthen through the spine. Exhale, melt the shoulder and shoulder blades down. Inhale, raise the hands up. Exhale, side bend to the right. Inhale, up. Exhale, side bend to the left. So we're lengthening out these side bodies here. Inhale, up. Exhale, side bend to the right, lengthening out this left side body. Inhale, up. Exhale, side bend to the left. Again, lengthening out this right side body here. Inhale, up. Exhale, relax your arms down into your lap. Figure 4 stretch. Let's bring this right ankle on top of the left knee. If this is not comfortable for you, then you'll just cross the right foot over the left. But if it is okay for you, it is comfortable, bring it up. You might find that your leg is a little bit lifted, and that's okay, that's normal. You might have tight hamstrings or a tight IT band. Let's flex this right foot. When we flex the foot, it brings stability to the knee and the knee ligaments. And you could just stay right here, inhaling and exhaling. As you inhale, you're giving a lot of breath, a lot of oxygen to that right leg. Maybe you feel the stretch in the right IT band, that's on the outside lateral leg. Maybe you feel it in the right back pelvis, maybe the piriformis muscle, and maybe you feel it in the low back. And just relaxing the hands. Inhale. and exhale. And if this is okay for you and you feeling like you want to go a little bit further, you're going to inhale, find length through the spine, the top of head. Exhale, hinge forward at the hips. We're not curving the spine. We're not losing integrity of the spine. We're keeping the spine and the back of the head in this, thinking about it as this one long line, slight tuck of the chin. Gaze is at the ground. Inhale, lower jaw falls away from the upper jaw. Exhale, tongue falls from the roof of mouth. Inhale, come back to a neutral spine. We're going to inhale the left arm high. Exhale, twisting towards the right. The left hand lands on the right knee. The right hand is somewhere behind us. It's either holding onto the chair or holding onto the seat of the chair, and we're twisting towards the right. But we're not using our hands to pull us. We're letting our back and our shoulders do the twisting. So we're inhaling, lifting through the spine, exhaling, twisting the shoulders tiny, tiny. Inhale and exhale. Keeping the nose in line with the sternum as best that you can. We don't have much rotation through the thoracic spine, and that's what we're building flexibility in. We're not turning the neck so deep because we have a lot of flexibility in our cervical disc, in our cervical vertebrae. So we're trying to build more flexibility through the thoracic spine. Inhaling, lifting, exhaling, twisting, and back to center. Let's switch the cross of the legs. The left leg comes up now. Again, if this is not comfortable for you, you're crossing your left foot on top of the right foot down at the floor. If this is all right for you, you're going to bring this leg up. Slight flexing of the foot just to protect the knee. You could relax the foot and see how it feels, but flexing feels a little bit better because you're also getting that additional calf stretch. So right here, we're finding, again, length through the spine, length through the top of the head. Exhale, we're grounding down into our sitting bones, into the surface we're in. Inhaling and exhaling. If you want a little bit more, we're going to inhale, lengthen through the top of head. You could tuck the chin a slight bit. Exhale, hinge forward, just enough so that you can feel an activation of the stretch of this left IT band. Hands are in any relaxed position. It could be crossed over. Just relaxing in any position. Exhale. Lower jaw falls away from the upper jaw and the tongue falls from the roof of mouth. Inhaling and exhaling. Inhale, coming back to neutral. We're going to inhale that right arm high. Exhale, twisting towards the left. Right hand is somewhere on the left knee. Left hand is somewhere behind us. Again, we're using our back muscles to twist. Inhaling, lifting. Exhaling, twisting the shoulders. And again, we're not using our arms to pull us, to pull the spine. We're just twisting. Keeping the nose as close to the direction of your sternum, avoiding the urge to twist the neck even further. There's a habit that some people twist a little bit more by their gaze. And what we want to do is twist our shoulders to build more flexibility through the thoracic spine. Inhaling, exhaling, back to center. Wonderful. Let's drop the foot down. And let's widen the distance between our feet. Our hands could be rested on our knees or on our thighs or on the chair seat. Let's do some cat-cow. So we're going to inhale, push the chest through. And if you have some posterior bulges, you're going to tuck your chin and look down at the ground. And you're just pushing your chest center forward, undoing all that hunching over. Exhale, round. Push the space between your shoulder blades back. Chin is reaching for the chest. Inhale, reach the chest through. If your neck health is okay, that's where you can gaze more horizontally or more upward, getting a good stretch in the front of throat. It's up to you, but you do need to pay attention to any pain that you might have. If you do, back out. Exhale, push the space between the shoulder blades back. We're building space in between those posterior discs. Inhale, pull the chest through. And when we do the pull the chest through, we're building space of the anterior disc. Exhale, round back. Inhale, up. Exhale, round back. Bringing your spine to a neutral position, heel toe the feet towards one another, and we'll finish with 3 cleansing breaths. And you could add the arms, or you can have your hands relaxed in your lap, your choice. Inhale, arms up, palms together, open your mouth. Exhale, hands to chest center. Inhale, arms up, palms together, open your mouth. Exhale, hands to chest center. Inhale, arms up, palms together, open your mouth. Exhale, hands to chest center. Bring your fingertips to your forehead in a reminder of stillness of mind. Bring your fingertips to your lips in a reminder to speak your truth. And bring your hands to your heart in a reminder to give your gift to the world. Thank you. You may spend the next few moments in silence while you continue to breathe and just feeling any new freedoms in your body. See you next.